Hello and welcome to the EduTalk series hosted by Biotone Edu Partner Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Tonight's expert is Eric Brown, who began his massage career in 1989. He pioneered chair massage in Canada, training thousands. He launched BodyworkBiz, an online continuing education platform, and has worked with ABMP to develop in-person and online summits. As an author, whose books can be found on Amazon, entitled Chair Massage Techniques, Chair Massage Marketing 101, 60 Clients in 60 Days, and Fill Your Practice. He continues to support lifelong learning with his wife, Ann Williams, through their business, Massage Mastery Online. Let's listen and learn as Eric discusses the feigning phenomenon, a well-known, mysterious side effect of chair massage. He'll explain why it happens and how to prevent it from happening to your clients, while outlining the physiology behind the feigning phenomenon and sharing effective ways to avoid this happening in your chair. So feel free, please, to chat questions and comments during Eric's presentation, which he will answer at the end. Thank you so much for joining us. We have a lot to get to, and I'm just as curious about this as many of you are. Let's solve the mystery, Eric. I'm turning it over to you, and I'll see you on the other side.
All right. Yeah, so let's solve the mystery of the fainting phenomenon. I'm Eric Brown, and chair massage is my area of expertise. So if you have any questions about, although we're going to be focusing on fainting in the chair and why this happens, you may or may not have heard of this, or it may or may not have happened to you. But if you have any questions on any aspect of chair massage, whether that's techniques, the equipment, the business of chair massage, I'm happy to answer those at the end of the broadcast as well. So I'm going to start sharing my screen here. I have a few slides to show, and then I'm going to come back at some point during this presentation. Find my screen here. There we go. And hopefully that's all good and you can see my screen. And then I think, okay. So let's do this formally. Welcome to the presentation on the fainting phenomenon. I want to thank Biotone and Danelle for inviting me to talk about one of my favorite subjects, which is chair massage. I got involved in chair massage in the early 90s. The first massage chair came out in 1986, so I was very early and into chair massage and hopped on that bandwagon early. And I was one of the first people doing it in Canada. The father of chair massage, David Palmer, he saw chair massage as a way to popularize massage and make touch a positive social value. And I have to acknowledge and give thanks to David for setting me on a mission that would really change my life. But more to the point of this presentation, I was told early on by David Palmer that about 1 in 1,000 people would faint when getting seated massage. And that seemed odd, and I couldn't understand why it would happen. But I kept it back in the back of my mind as I sort of branched into this up-and-coming area of on-site massage. The idea that people would faint because of massage didn't make sense to me. I've owned 2 successful multi-therapist massage clinics, and my staff has done tens of thousands of massage treatments over the years. And in all that time, we've never had anyone faint on a massage table. Occasionally, people report feeling dizzy immediately after getting off the table, but we know that that's known as postural hypotension, as their blood pressure adjusts standing up, and it self-corrects after a few seconds. Now, I also had a chair massage business. We provided massage to some of the biggest corporations in Canada. American Express, Dell, Ernst & Young, The Gap, IBM, Kellogg's, Levi Strauss, Nintendo, the United Way, to name a few, as well as most major Canadian banks, hospitals, major financial institutions, and pretty much every major law firm in Canada. And I kept waiting, thinking about what David Palmer said about fainting. I kept waiting with sort of a certain level of anxiety for someone to pass out in the chair. But about 4 years went by without incident. Now, up to that point, I trained all my practitioners personally to guarantee that clients got a safe and consistent quality massage. However, I was getting some big contracts where I needed to bring in 10, 20, and at one point 30 practitioners to a site. And so to feed that growing demand for practitioners, I started a professional training program in chair massage. And that was back in 1998. And I brought in a teaching staff to assist me with these larger groups of students. Now, a few months after we started our first program, it happened. Somebody fainted. Now, the incident occurred during an open house for the school. I was teaching the group a few techniques in the massage chair so they could get a sense of how chair massage worked. And of course, as an instructor, you walk around the room observing the practice. And I passed one woman and she lifted her face out of the face rest and she said, "It's hot in here." Then almost immediately, her eyes rolled into the back of her head and she began shaking. And so I reached to stop her from falling out of the chair. And I asked the woman's husband, he was the one who was massaging her, if she had seizures. And it wasn't a seizure. She had simply fainted. The woman regained consciousness relatively quickly, and she ended up continuing with the rest of our workshop. And she and her husband even enrolled in the professional training program I had. So I had finally had my first experience with someone fainting in the chair, but this wasn't my last. In that first year that I opened the training program, we experienced a whole series of fainting episodes. I would say maybe up to a dozen. And I was alarmed and baffled. How was it possible that I could go for 4 years without having anyone faint, then suddenly have people start dropping like flies? It just didn't make any sense. We had to figure this out because this is just not good for business when you have people dropping out of your chair. So, of course, the first question you ask yourself when you're looking at something like this is, why do people faint? Now, it could be something serious. So it could be something like serious anemia. It could be some kind of heart disorder or stroke. It could be heat stroke or heat exhaustion. Or it could be something that might be a little bit more benign. So just changing your body position, like standing up too quickly, dehydration, drinking too much, maybe pain, maybe because of blood pressure regulation associated with pregnancy. Now, these are not anything serious. It just happens occasionally in response to a particular circumstance. But if you look at that list of causes of fainting, most just don't apply to a healthy person getting massage. And again, I've never had anyone faint getting table massage. So why would people faint with chair massage? So as we had incidents of fainting, we'd look at a variety of factors to see if we could determine the cause. And that way we could put something into our screening process that would, take these people out so we wouldn't have the issue. And why was this fainting reflex again triggered with chair massage? Now, I've heard a number of explanations as to why this happens. David Palmer's explanation, and I have to say he's an AMA practitioner, and that's an acupressure technique. So his theory was that hitting certain acupressure points in the hand could cause someone to pass out. But I never heard of anybody passing out getting hand massage when laying on a table. So it couldn't be the massage technique itself. That just didn't make sense. And I had also been told that fainting was more likely if the client hadn't eaten, but we couldn't relate any of these fainting episodes with the timing of their meals. And again, table massage clients don't faint whether they've eaten or not. Now, we knew that, or we all know, that massage decreases your blood pressure to a certain extent. When you're relaxed, your heart just doesn't pump as vigorously as it normally does, and your blood pressure drops. And with chair massage, the person remains upright, and so the heart has to push blood against gravity to reach the brain. But blood pressure regulation systems in healthy people should be able to compensate for this. And of course, you never faint when you're just sitting upright in a normal chair, no matter how relaxed you are. So if relaxation was the mechanism behind fainting, I would expect this to be a gradual process and for the person to report feeling lightheaded and dizzy instead of just passing out. And sometimes this did occur, but those kinds of occurrences didn't seem to be that significant. What surprised my team was that almost every fainting episode happened very quickly with very little warning. And a relaxation-induced drop in blood pressure just, in my mind, couldn't account for that kind of dramatic effect. So we began to interview chair massage clients who had experienced fainting to see if we could find some commonalities that we could include again in the screening process. But to our dismay, they seem to have little in common. Their ages range from as young as 10 years old to about 60. And the fainting occurred at no particular time during the massage session. Sometimes it happened within a couple minutes, and sometimes, or think of one time in particular, it happened about at the end of a half-hour massage. And there was no trend in terms of what body part was being massaged at the time when they fainted. And it didn't seem to be related to their blood pressure or menstruation. Now, there were a couple things that were significant, and one is that most cases involve women, but most of our clients were women, so that would be understandable. And then there was a disproportionate number of pregnant women who fainted. And we know that blood pressure regulation in pregnant women is a little wonky, to use a medical term, so that wasn't surprising either. Now, one day, the staff and I were sitting around and discussing this issue when one of my senior trainers, her name was Cam Tor, she suggested that the carotid sinus reflex might be the culprit. And as we started to explore this possibility, it just made perfect sense. So, what is the carotid sinus reflex? Have you even heard of it? Well, let's look at some anatomy here. This is a look at the carotid artery. Basically, it branches off of the aorta. It comes up on both sides of the neck. And then around C4, it bifurcates into two branches. One branch brings or supplies the face with blood. The other branch, which is the internal carotid artery, supplies the brain with blood. So it's a major artery or major blood vessel supplying blood to the brain. Now, this artery contains baroreceptors, and baroreceptors are blood pressure sensors, and they help regulate the flow of blood to the brain. That is a tongue twister, blood to the brain. So they regulate the flow of blood to the brain. If the baroreceptors sense a quick rise in pressure in the carotid artery, then they initiate a reflex, and that's called the carotid sinus reflex. And this reflex slows down the heart, and it causes a generalized peripheral vasodilation to quickly drop somebody's blood pressure. And it's just a simple protective reflex. If your blood pressure increases suddenly for whatever reason, so let's say you are a 90-year-old man and you decide to sprint for the bus. With that activity, you'd have a sudden surge of blood to your head, and this could rupture blood vessels and cause bleeding in the brain, and that's not a good thing. So these baroreceptors trigger these regulatory mechanisms to get the arterial pressure very quickly normalized when necessary. Now, if I put pressure on the front of the neck, what I do is I block the flow of blood in the carotid artery, and the blood has nowhere to go. And so what it does is it stretches the arterial walls, and the baroreceptors interpret this stretch as a rapid increase in blood pressure, and they trigger the reflex, which causes, again, the heart to slow down very quickly and dramatically. And the result is either extreme lightheadedness or a fainting episode. And that's exactly what we're seeing in the chair. It wasn't a slow process. 1 second they felt fine, and the next, without warning, they were out cold. And it doesn't take a lot of pressure on the carotid sinus to cause this reflex. Researchers have found that the reflex can be triggered by even very simple neck movements. So like turning your head while you're shaving, or turning your head around to the back as you're backing up in your car. And it can even be caused by just even wearing a tight collar. So the carotid sinus reflex seemed like a plausible explanation, more than a plausible explanation for this fainting. Somehow the carotid arteries were getting compressed. I should add too that the carotid sinus reflex gets increasingly sensitive as we age. And researchers have found that about 9% of the population has a genetic hypersensitivity to this reflex. So again, this was the most plausible explanation for these episodes. And we actually proved it in practice, which I'll explain in a moment. So knowing this, how do we avoid triggering the reflex? Okay, first thing is to avoid anything that is going to put pressure on the neck. So if you're massaging somebody in the chair, make sure their ties are loosened up before they sit in the chair. Undo the top button of their shirt, and maybe even jewelry if they have tight jewelry. Now let me just check. Oh yeah, here we go. Next slide. The most important thing you can do though is ensure the proper positioning of the face cradle. Now what I'm going to do is I'm just going to stop sharing for a second here. So I think that'll put my video up front and center, so I can explain this process a little bit better. Let me stop sharing. There we go. Hopefully you can see me there. Okay, so this is a face cradle. Now, my face. Normally when we look at somebody's face, we think of the nose being in the middle of the face. And that's because when we're talking to somebody, we focus in this narrow area of the face, and we have the eyes at the top, mouth at the bottom, nose in the middle. If I draw a happy face, I draw a big circle, mouth at the bottom, eyes at the top, nose in the middle. But if you've ever taken an art class, or you look at the face carefully, the nose isn't in the center of the face. It's actually the eyes that are in the center of the face, in the center of your head, I should say. So your eyes are in the center. Now here's our face cradle. Now most people see this, let me put it this way here. Now most people see this as a target when you're putting your client's face in here during chair massages, you're setting them up. And the center is the bullseye. And normally you think of the nose going in the center. So the nose has to hit the bullseye. I'm taking my glasses off here. If I do that, however, this happens. Okay. If I see my eyes as being in the center, then I get this kind of thing where my eyes are free of the face rest and I can see right through. Now, if I line this up like the nose is the center of my face, okay, my eyes get covered by the top of the pad. But what I want you to note in particular, and I don't know if I can get an angle to show you this, is the bottom corners of the face rest. Where are they? They are on my neck. They're pressing on my neck right here. Okay, so that's why the positioning of the face cradle is so important, because if this comes too low and the pads hit the bottom of the neck, then what happens is you compress the carotid arteries and you initiate this carotid sinus reflex. Make sense? Okay, so the most important thing you can do to avoid triggering the reflex is make sure you get their head positioned properly in the face cradle. And let me go back to sharing. Okay, let me show you some examples. I'm going to show you some pictures. We'll get off the cartoons. We'll take a look at some. Oh, no, I'm not sharing yet. There we go. Now, hopefully you can see my screen. Now what I do is chair massage is so badly done that I have a folder in my computer called Chair Massage Gone Wrong, and I put pictures in there when I come across them. Now these are a couple stock photos, but I want to just illustrate a few things here in terms of the setup of the chair. Now here on the, I don't know if you can see my mouse or not. or my cursor. But the chair seat is very flat here in the picture on the left. So it's horizontal. The chest support is low, and the person is basically falling over the top of the chest support. And this headrest is very horizontal. So their head is in a very awkward position. So this is not how you want to set up your chair. This is the same photographer, obviously. And we see a similar kind of thing here. The chair is flat. What I want to bring your attention to is that this person's bum is towards the back of the seat. Just want you to notice that here on this one. The other thing I want you to do is take a look at the setup of the face rest. And again, I'm not sure if you can see my cursor moving here or not, but the face rest on this picture on the right-hand side, again, is almost horizontal. And we can see in both of these pictures, this picture on the right and this picture on the left, that the bottom ends of the face pad are pressing into the neck. So these are good candidates for fainting in the chair. Now, how do I know if the face rest is set up appropriately or not? Well, take a look at the top of this gentleman's head, and you can see it's basically right in line with the top edge of the face cradle. And when I see that, I know almost always that the head is too high up in the face rest and that the ends of the pad are going to be pressing on the neck. Here's a couple others. Again, take a look at this face rest and this one on the left-hand side. The setup of the chair is horrible. Again, his bum is right at the back edge, and this will become important later when I talk about the chair setup. And this is almost horizontal here. So this is a very uncomfortable position. And again, you can see it pushing in the front of the neck. On the right here, we see sort of a different situation. This is the first chair we see an actual face cradle cover, but this guy's falling through the face cradle. And again, this is going to be pressing on the front of the neck. Again, these are good candidates for fainting. And this is a horrible setup. This is the worst yet. We can see here that the chest piece is angled at about 45 degrees, but he's not even leaning against it. This face rest is pushed so far towards him that he can't even lean forward on the chest support. And notice that this is the face rest is pretty much in line with the chest support. It's almost vertical here compared to the other ones that were horizontal. And of course, we can see that his head is even with the top of the face cradle, but he's so oddly positioned here that it's not affecting the compression of the neck with the face cradle. Now, let me show you this as comparison. So this is the way a person should be set up in the chair. The chair seat should be angled slightly forward instead of being horizontal like we saw in some of the others. And the chest support should be at about 90-degree angles to the seat. So that's ideal there. You're going to get your client to slide their bum forward on the seat so that they're fully supported here by the chest support. And that's very important. You don't want their bum right at the back edge. You want them to slide forward as much as they can so they get good support by their abdomen. And I'll explain why in a minute. You can see here, if we take a look at the top edge of the face rest, that there's a few inches, maybe 2 inches or more between the top edge of the face rest and the top of her head. So she's positioned in here nicely. If I imagine her eyes right here at this point in front of her ears, we can see that her eyes are pretty much right at the halfway point of the face rest. And if I take a high view of this, you can see this even better. You can see here, I'm just palpating the edges of the traps, but you can see here at the neck that there's tons of clearance. So this is the way to set up the chair, and you are unlikely to have anybody pass out if you do this one thing. So that's the mystery solved. Now, you might be asking yourself, I've mentioned already that some people pass out at the very beginning of the massage, some people at the very end. So why don't people pass out right away? Why this discrepancy in times? Well, there's a simple explanation for this, and it comes back to what I just mentioned about the way that clients sit in the chair. When most clients sit in the massage chair, they tend to sit near the back edge of the seat. And because the seat is angled downwards, typically the client slides forward as the massage progresses, especially when the therapist is pushing into their back. So as the body slides forward, what happens is the head moves up on the face rest, and then the bottom ends of the pad start to press against the neck. And once there's sufficient pressure to the carotid arteries, the reflex is triggered. So you can largely prevent this movement in the chair and the face rest by telling your client to slide forward and making sure that their abdomen is fully supported by the chest support before you start the massage. And even if you do all of this proactively, make sure they're slid forward in the chair, make sure the face rest is properly positioned. I would still advise that you check the positioning of your client's head partway through your massage. And in particular, of course, I want you to confirm that the bottom ends of the face rest are not pressing against the neck. So taking a moment to check for this and repositioning the face rest if necessary is going to reduce your chances of having someone faint in your chair to almost nothing. So what happened in our situation after we started focusing on the proper chair setup with our students, and that is getting the client to slide forward again and relaxing the chest support before locking in the headrest, and making sure that the head is positioned properly in the face rest. So after we started focusing on those aspects of the chair setup, we had almost no episodes of fainting. So I think our theory was proved correct. Now, you may come across situations where somebody just simply feels nauseous or lightheaded in the chair. And these are typically situations where blood is diverted from core circulation for some reason. So they just ate a meal. Or imagine they just exercise and suddenly they sit in the chair, they're bending their legs. There's not a free flow of circulation in the legs in that kind of position. Or maybe it's just hot, like it was in the, in the room when I was doing that workshop with that woman. And nausea and lightheadedness, again, is more likely to be experienced in pregnant women simply because of issues with blood pressure regulation. So people may experience nauseousness and lightheadedness, but it's sort of a different, it is a different mechanism than these rapid fainting episodes that we come across. Now, is there any way to predict that a person may faint? Is there any signs that would help us recognize this? Unfortunately, the answer is no. There's very few signs that indicate a person is about to faint. It happens fast. But just before fainting, the person is likely going to experience a number of things. They might feel dizzy or lightheaded. They might feel nauseated. They might feel weak. They might have a sense that the ambient noise that's around them is fading. They might see spots before their eyes. The person knows that something is not quite right, but unless they've experienced it before, they might not know that they're about to pass out or faint. And typically they're just too embarrassed or too confused to say anything, which means that they'll faint without any warning. Now, the most common indicator that the client is experiencing this is if you see them squirming in the chair. They're having some of those symptoms I described. And again, they're too embarrassed or confused to say something immediately. So they start to squirm to try to stop those symptoms and start to feel more comfortable. So if you see them moving around and the reason for them moving is not immediately evident, just stop and ask them specifically if they feel lightheaded or nauseous. Now, you may see somebody's skin turn pale, even if you're just looking at the back of the neck, but that typically happens as they're passing out. Now, the whole experience for you as a practitioner can be frightening if you've never seen it before. I'll give you that warning. The person's eyes will sort of roll back into their head, and then you'll hear a very distinct breath sound. The client starts to stiffen up and maybe even convulse. And sometimes the convulsions are just like a light tremor or a light shake, but sometimes it might even appear as though the person is having a mild epileptic episode, if you've ever seen that. So it's important to note, well, I guess here, what to do when someone faints. The number one priority is don't let them fall out of the chair. So it's, you need to know that fainting itself is not harmful. It's simply nature's way of making you stop what you're doing and putting you on the ground until your blood pressure normalizes. So your concern, your primary concern as a therapist, is really making sure that the client doesn't fall and hurt themselves in the process. The fainting is fine. Falling is probably not good for them. So being on the floor is the safest position for the client until they recover. So what do we do? So if somebody gives you some indication that they're not feeling well, again, the most common symptoms are lightheadedness, dizziness, nauseousness. If they have if they're in a state of mind where they can inform you, don't leave them in the chair and get them a glass of water or a cold compress. Your primary consideration is getting them on the floor as quickly as possible while they're conscious, so they don't fall. And the way to do this is illustrated here in this series of pictures. What you want to do is you want to get as close to the client as possible. So you're going to put your foot beside the chair, 1 foot ahead of the other. Don't stand with your feet together. Put 1 foot ahead of the other so you have a nice wide base. And then as you see here in picture 2, what you're going to do is you're going to put your elbows underneath their armpits. So this keeps them close to your body, keeps their center of weight close to your body. So if they fall, you don't have your arms extended. And then you're going to ask them to shuffle back off the chair. And then as they shuffle back, you're going to get them to bend down and go to the floor. And you can assist them in that process. Don't let go of them in that process. Now, what happens if they faint as you are moving them out of the chair? Don't try to hold them up, whatever you do. They're going to be a dead weight. You're going to hurt yourself. So you can see here in picture 3 that they are pretty much leaning against your front leg. So you're just going to let them slide down your body to the floor. And if you can, if there's any possible way, take your hand that's underneath their armpit and put your hand to the side of their head so they don't hit their head on the floor as they fall. And just collapse with them, fall with them. Don't try to hold them up. Just go with it. Let them slide down your body and fall with them to the floor, making sure that you do your best to protect their head from hitting the ground. Now, the other situation you might come across is somebody faints right in the chair. They don't give you any notice, or they may start to sit up and then collapse forward. What do you do in this case? Well, if you can, turn their head to the side. If not, don't worry about it. Even if the pad is compressing their neck, it's not going to be a big deal. Their body is going to adjust to that momentarily. It was just the reflex was triggered, but the reflex is finished. So if you can, turn their head to the side. But again, our primary concern is that they fall out of the chair. Most people don't. Most people are pretty centered in the chair and it doesn't happen. But in any case, what you want to do is you want to, again, take one leg forward, come very close to them, wrap your hands around them and grab onto the chair. And especially if you're a smaller practitioner and you have a big client in the chair. And just hold on to that chair. Just hold them in there until they start to regain consciousness. And then, so what to do when someone faints? Okay, this is a summary slide. Okay, don't leave them alone. Make sure you stick with them. I have seen a case where a practitioner, the person has said, I'm feeling lightheaded. Therapist says, I'm going to get you a glass of water. They walk away, and as they turn their back, the client fell out of the chair. So don't leave them alone. Stick with them. If you can, get them on the floor. If you can't, if they faint before you get them on the floor, then hold them in the chair. And if they fall, either as they're getting out of the chair or whether they're in the chair, you want to protect them as much as possible. So be a crash mat for them. Hold on to them, fall with them, and again, try to protect their head from hitting the floor. Most of all, do not panic. Stay relaxed. Fainting is not going to hurt them. So this is all going to be over in minutes. So just stay relaxed. Now that you know what's happening from this presentation, hopefully you can just take a few deep breaths and just go with the process. Now, what happens to the person after they faint? As they start to recover, typically they are never angry or upset. Most people are embarrassed more than anything. So be as discreet as possible in handling the situation. Don't make a big deal out of the incident. Just reassure the people around you, if there's people watching this, that your client has just fainted. Let them know that this happens occasionally and you've been trained to deal with the situation. Sometimes dealing with the people around you is more difficult than dealing with the actual situation. So if you have people around you, address them right away so they don't panic, so they don't start calling 911 and making this into a big ordeal. Because there's no need for alarm or to call emergency medical services. And what you're going to do is you're just going to simply stay with the client until they regain consciousness. Now, you can talk to them and let them know you're with them and let them know they fainted and that they're going to be okay. Now, initially, they might not be able to hear you, or your voice might feel like it's a million miles away, but just keep talking. As they regain consciousness, they're going to feel a little foggy and maybe seem a little confused, and they won't understand why they're on the floor. So again, as they start to become more lucid, talk to them in a quiet, reassuring voice and let them know they fainted. Let them know it happens sometimes, and it was likely the face rest was pressing into the front of the neck to cause this carotid sinus reflex to occur. Also let them know that 1 of 10 people have a genetic sensitivity to this reflex, and they just might be one of those people. So just handle it calmly, stay calm through the process, just talk them through it. I had sort of one funny situation that happened where I was supervising a group of students and we were doing sort of an outreach or a practicum at a department store. And 2 young women who were friends decided to get a chair massage. And they were sitting right next to each other. Within a couple of minutes, one of them fainted. I was right there. We got her on the floor. And after the 15 minutes of massage, her friend got out of the chair and said, "Wow, that was fantastic. I got so relaxed." And she looked at her friend, who by that time had recovered, and she was like, "How was your massage?" And she had no idea that her friend had passed out and had recovered in that 15 minutes. We handled the incident so smoothly and quietly that she was completely unaware that anything had happened at all. The woman who had fainted was more or less back to normal, after another 10 or 15 minutes, and they just continued their shopping in the mall. Now, the person that's fainted might feel a little nauseous too, so I'll tell you that. That feeling will gradually pass. I've only heard of one incident where a client actually vomited. It never has happened to me. And then in terms of recovery time, everyone is different. They're likely going to regain consciousness within seconds, but it might take a minute or maybe a couple of minutes before they are lucid and they're understanding what you're saying. And then after that, they're going to feel a little nauseous or groggy for a short while as their body normalizes. Some people might be fine and ready to go on with their business within 5 minutes. You might need to stay with somebody for 30 minutes before they start to feel normal again. So some people recover from these incidences very fast, some people more slowly. And some people even feel out of sorts, throughout the rest of the day. They don't feel quite right. So everyone is a little bit different in terms of recovery. Okay. So now that you know a lot of details around the fainting phenomena that happens with chair massage, let's step back again and just take a look at the bigger picture before we close here. And so I've created this flow chart just to sort of guide you through some of the decision-making process that has to happen when somebody faints. So first of all, is the fainting typical? if it's not typical, so for example, if their breathing gets very erratic, if they are they're bleeding somewhere, or if, sorry, I shouldn't laugh, if they're convulsing, that's not a typical fainting episode. So if anything seems amiss, then just call 911 and get them help. But if it seems relatively typical, you're going to check their breathing and their pulse. Again, if they have no breathing or pulse, you're going to begin CPR and you're going to call 911. But chances are they're breathing fine and their heart rate's going to be fine. In that case, you're going to make sure they're on the floor and ideally put them in recovery position. Now, normally you put somebody in recovery position if they're unconscious. And that's simply so if they vomit, they're not going to choke on their vomit. But you also can put them on their back and bend their knees or elevate their feet. That's a possibility as well. The next question is, have they regained consciousness relatively quickly? And I would say, they need to be conscious within 2 minutes. Normally it happens much faster than that. If not, seek emergency care. Again, something is wrong if they're not regaining consciousness. If they have regained consciousness, then all you need to do is just make sure you stay with them until they are fully recovered before you let them go on their way. And so they can just sit quietly. You can sit with them and just make sure they're fine. Don't let them go on their own until you are convinced yourself that they're recovered, because some people are going to, again, they're going to be embarrassed. They're going to want to go and do, remove themselves from the situation. Don't let them do that. So that's what you do when somebody faints in your chair. So in closing, I just want to thank you for attending this presentation. I know everyone's time is valuable. I hope you walked away with some practical knowledge to keep you and your clients safe. You now know about the risk of fainting during chair massage, and you understand the mechanisms. And you know that you can largely prevent these fainting episodes by paying close attention to the way you set your client up in the chair. Again, making sure that their face is centered in that face rest and that the pads doesn't press on their neck. And if someone does faint, following these simple guidelines that I've outlined here today is going to help you prevent injuries, keep your client safe, and it's going to make sure everybody has a positive chair massage experience. Now, I don't know if this is the point where I'm supposed to make a sales pitch before we go into Q&A, but I have nothing to offer you, really. I have a chair massage techniques course in process at Massage Mastery Online, but that's not going to be released until the fall of 2023. As Danelle mentioned at the beginning of the broadcast, I do have a chair massage techniques book and a chair massage business book available on Amazon. They're low cost and great resources. So I would suggest you pick them up. Danelle is going to send you a email after this is done. It's going to come from Biotone, right? So you're going to have those links in there as well as a replay to this broadcast. So look out in your email for a that email from Biotone that Danelle will send you. And having said that, I'm stopping sharing. Did I stop sharing or you stopped sharing?
I stopped sharing for you.
Okay, great. And I'm ready for if anybody has any questions about any aspect of chair massage. Again, it doesn't have to be on this fainting phenomena. I'm happy to talk about techniques, equipment, business, anything you want. Just throw them in the chat and Danelle can send them my way. And then
we can answer them. Excuse me, we can answer them right now. We did have some chats come in, Eric, but sorry, I just interrupted you.
Yeah, I was just going to say, if questions come up afterwards as well, if you go to Massage Mastery Online, there's a contact us button or link at the bottom of every page. If questions come up for you after this broadcast, by all means, go to Massage Mastery Online, go down to the bottom of every page, click the contact us, and I will get that email directly. So I'll happily answer your questions after this as well, if something comes up for you.
Well, wonderful. Well, let's get to the chats. And if a client has a large chest, are there any modifications recommended with how she is seated?
Yes. Yeah, that's an excellent question. You're going to get all kinds of body sizes and shapes. Now, first of all, I would suggest that you get a good chair that has a variety of adjustments on it. One of the most popular ones you'll see is a small chair, and it's all kinds of companies knock it off, but it has very few adjustments on it. And so it doesn't really accommodate a lot of different body sizes and shapes. So my recommendations in terms of chair, but my favorite chair is the Strong Light Ergo Pro. It has the nicest balance of ease of use and client comfort. So it strikes a nice balance there, because every chair sort of fights with those two things: is how easy is it for you to use, and how comfortable is it for the client. What you want to look for in particular, if you don't have the Strong Light chair, is a chair with a double action face rest. So that's the one that not only tilts up and down like this, or goes up and down this way, but also translates towards the client's face. So a double action face rest. And this is particularly important if you're working with anyone that has like a barrel chest, like a big man with a barrel chest, or a woman with larger breasts, because that will allow you to move the face rest towards their face, so you can situate their face comfortably there. The other thing I would suggest you do is take off the pad off the chest support. It won't affect their comfort. They're going to feel fine just leaning against the that flat wooden or metal plate. But what that does is it allows them to move closer to the face rest, because this is our primary problem with situating people with large chests, is they just can't reach the face rest. They're way out here and they can't get their head forward far enough. So those are the two things to do: take off the pad off the chest piece so they can come forward, make sure you have a double action face rest, and bring it up towards the face.
All right. We have, this was très cool. Looking forward to seeing the recording so I can hear some things again. And looking forward to the next time I do seated massage, so I can make sure I am seating people more carefully. And thank you, Eric.
Oh, you're very welcome, Trey. Cool. And Danelle, you're going to include a link to an article that I did for Massage and Bodywork magazine as well. It sort of summarizes all this information that you got in this presentation as well. So that's it's a free download. So make sure you download that as well.
Exactly. And very interesting. Didn't know about this, and I just Googled the chair recommendation. Thank you. And I hadn't heard the brand name Strong Light in many, many years, but that was good to know. That's a good table, and that you would recommend that.
Yeah, and I have tried. I pretty much have purchased every chair that ever has come out on the market. So you know, it's an informed recommendation. As a runner-up to the Ergo Pro is the Oakworks Porta Pro. Is I think the brand name of that one. It has a good range of adjustments on it as well. The thing I like about the Ergo, the Strong Light chair, is that it has an independent height adjustment for the practitioner. And it's hard to understand unless you see the chairs side by side and compare them. But if you're a tall practitioner in particular, this is a fantastic chair, because you can adjust the height of the chair without changing the orientation of the seat and the chest piece, which happens with the Oakworks chair. The other things I like about the Strong Light is that it has just some smart little things, like the front edge of the seat is cut out so that the seat is not pressing on the back of their legs. It also is the only chair, I think, that has removable shin rests. So you know, I teach people how to do a full body massage, including the lower body right in the chair, and being able to remove those shin rests really facilitates your access to the legs.
Very interesting. Now, I have two things. I have not seen a lot of people out and about doing chair massage any longer. And I just wondered if that is a trend that maybe has cooled off a little. Do you have anything to say about that?
Yeah, I have something to say about anything. You want to ask me? I don't know if it's going to be informed or intelligent, but I can talk to that. So it really hasn't taken off the way that David Palmer anticipated it would, and we're really not quite sure why. I think it really has not been adopted wholeheartedly by the massage profession. It's sort of seen as the ugly stepchild. It's just a relaxation massage. It's just a neck and shoulder massage. And so it gets poo-pooed in the profession. It's not really being real massage. When in fact, and so practitioners or the industry, the profession as a whole, that should have been moving it forward, really has not embraced it. The industry, if you've been in this industry for any length of time, you know that there has been an increasingly or an increasing emphasis on medicalizing massage as a way to legitimize it as a healthcare profession, mostly to move away from the perception of massage as being, a sex service, which was the case, in the 60s and 70s. The industry has made great strides, since the 80s in a concerted effort, largely led by the AMTA to sort of legitimize it by medicalizing massage. So they've done a good job of that. But in the process, I think we've moved away from this vital role we have as massage therapists for providing safe, structured touch in a way that's very accessible for people. So that's sort of my take on it. But I really chair massage still is very active field. I'm in touch with, although I don't have my chair massage company anymore, I'm in touch with a large group of people, primarily in Canada, that do chair massage, and they are busy, and they are still going into corporations and, well, doing it everywhere, not just in corporations, but in all kinds of environments.
Well, thank you for saying that. And as you were speaking, I thought, oh my goodness, COVID could have probably stopped that dead in its tracks for several years. And maybe it's time to come back. My other question to you was an intake form. Like, even if I'm, let's say running into Whole Foods and the chair massage is there, and I'm gonna get this first before I do my shopping. Should a therapist have an intake form which does ask some of these questions? Are you pregnant? Are you feeling lightheaded or nauseous? Any of these things? Is that typically done, and would that be a good idea to include it?
Well, it's important that you follow any regulations that are in that govern your jurisdiction. So if you need to do that, then you need to do that. And of course, even if you need to do that, you can use modified forms that are shortened to gather that information. What we do, what my company has done, and again, we've massaged, I don't know, just tens of thousands of people in all kinds of, mostly corporations, but in other environments as well. What we do is we don't have an intake form, but we have a very systematic screening process. So we ask a series of questions, and these, this is what we've developed over years, to screen out any contraindications as much as is possible. And so it's a screening process rather than an intake process, because we're dealing with a largely healthy population. We're out in places where people are up and moving around. So, these are not people that have, significant health issues. They're generally healthy. And so we just take them through a simple screening process. It's fast to rule out any contraindications, and then we get them in the chair. The other thing that we have done in the past as well is we just have a waiver form where they just, it outlines the questions that we ask in our screening, tells them to be aware of these things, and they sign the waiver form.
All right. And Meryl had mentioned that they sign a consent waiver, as well as asking if there's anything to focus on or stay away from. So I think that's, I can't remember the last time I got a chair massage, so I don't remember the upfront questions. I remember just jumping in the chair and than being ready for the massage. But I'd like to just quickly mention again that to watch your in basket, tomorrow you'll receive a follow-up with a recording link, a link to Eric's article on the fainting phenomena. It will also have a link to books that can be found on Amazon regarding chair massage marketing 101, 60 clients in 60 days, and fill your massage practice. And also the link to contact Derek with additional questions. Please join us for upcoming Edu Talks. In July 11th, we have Sally Spurgeon, breast massage for breast health and post-mastectomy clients. July 18th is the new Edu Talk Diabetes series, and Adrienne Asta, president of the Massage Therapy Foundation, will present evidence-based research supports massage therapy for diabetic health. And July 25th, we have Marianne Cisco, craniosacral therapy for post-concussion relief. And again, watch your in basket for the follow-up. If you do not see it by tomorrow afternoon, please check your spam. And will Eric ever be traveling to teach his classes, like maybe to Massachusetts, is the last chat question before we wrap up.
Yeah, I've stopped teaching massage workshops at Massage Master Online. I'm going to launch a course, like I mentioned, in the fall of this year. We've done all the content is done. We've shot the video. I'm just in the process of editing the video. That'll be available in the fall of 2023 sometime. So I'm sorry I'm not actively teaching at this point in time. And the techniques book on Amazon is an excellent book too, and we'll cover
a great place to get started.
Yeah, it's a great place to get started.
Well, thank you everyone for joining us for tonight's Edu Talk with Eric Brown. Watch your in basket, and definitely check the links in the follow-up, and feel free to contact Eric directly. Thank you, everyone. Be safe and get that chair massage. I mean, your chair out and start giving massages again.
Oh,
all right.
That's exactly what I want to hear. Dust off the chair massage, get it out there. Thank you so much, Danelle, and thank you everybody for taking the time to spend it with us today.
Okay, take care, Eric. Thank you. Bye-bye.